Hello and welcome. In this session we'll be talking about the options for international medical graduates in the field of internal medicine. I've received a lot of emails regarding this particular topic. And internal medicine, or medicine generally speaking, is what somebody does to become a physician, and it consists of approximately 30 different specialties. I'm sure you're aware of the major ones such as cardiology, respiratory, GI, neurology, but actually there are a lot more. The more smaller, less known ones obviously have a lot more competition because there are very few jobs in those ones. So one of my purposes of these videos is actually to give you honest advice in things that you will be able to succeed and establish a good career in the UK. Okay, and at the moment the good thing about internal medicine is that there are jobs in many subspecialties. There are definitely jobs in the training leading up to it, and also the more subspecialties. As an international medical graduate, you are at a disadvantage in many ways because of your visa, because of your language skills in many people, the culture shock, also the contacts you may not necessarily have, and as well as not being trained locally, you may not have the full idea of what's going on. So all these things give you a disadvantage. So why make your life more difficult by applying for something which hardly has any jobs? That way you have very little control of what's going on. So at least you should keep some strings in your hand and apply to things which are less competitive, and also there are jobs in round 2, which is where you guys particularly can apply. So how does application to medicine generally go? So it's have a general overview, and then you can obviously slot into wherever you fit in. So firstly, you have to get your GMC registration done, which includes doing the PLAB and the IELTS exams, and then getting the GMC registration. And after that, you should ideally do an internship or a house job, whatever, in your home country, and then come to the UK and do a standalone SHO job in a medical specialty, or an F2 job which has medicine in it. During that year, your mission is to get the F2 competencies signed. I'll be putting a link in my comment section on this particular topic. Also, after that, once you've got your F2 competencies signed, then you can apply to core medical training. Now, core medical training is a very solid grounding. It's somebody who wants to do specialist training in internal medicine, or in one of the subspecialties of internal medicine. Core medical training is for 2 years. So after doing your F2 or F1, F2 or F2 competencies, 2 years of core medical training, which consists of 4 6-month rotations. And ideally, you want to be doing at least one of those rotations, which you're going to be doing in the future as a trainee. So if you're interested in respiratory medicine, then in those 4 months, 6-month rotations, then you should at least have done respiratory medicine once. So that's the idea. And so in those 2 years of core medical training, you need to have also passed the MRCP. So you do your core medical training, which is for 2 years, and you pass your MRCP, and as well as the other requirements of core medical training, which you will learn as you go along. So you have to have done a certain number of cases, as well as procedures and clinics, etc. So once you've completed all the competencies and passed your MRCP, you'll have the core medical training certificate. If you don't pass the MRCP, which is not an easy exam, then you will not be able to move on to the next stage of application. For those who've already passed the MRCP, then they'll be exempt from doing the PLAB exam. The question arises that if somebody's already done 18 months of medical jobs outside their house jobs, then can they apply to core medical training? The answer is yes, because in 2017 they've changed the rules. So if you've already done more than 18 months of medical jobs, you can still apply. This rule is still the case for other specialties. For example, obs and gynae. If you've done 18 months of obs and gynae, then you can't get into obs and gynae training. I will be doing a separate video on obs and gynae, don't worry, later on. So where are we? You've done your F1, you've got your F2 competencies signed, you've done your core medical training and done your MRCP. Now you've got your core basic training, then you'll be going into the subspecialties of your interest. So this could be respiratory, GI, cardiology, acute internal medicine, geriatrics, whatever. But obviously at this point, the competition goes much higher. Okay, so think jobs such as cardiology, neurology are very far and few between. So, and they hardly end up in round 2, which is where international medical graduates apply into. Because unfortunately, in fact, I'm going to put a very important link. You should all, whoever watching this video, should look at this link. It tells you all the jobs according to subspecialty, which end up in round 2. So if you click on that link and it'll go into, for example, respiratory, and you click on it, it'll tell you how many jobs in the whole of the UK, different locations, how many jobs end up in round 2. So from that you can gauge an idea of which is the most competitive, which is the least competitive, and which sort of area has more demand. Okay, so that's very, very important to look at. If you've done your core medical training, and you've got the MRCP and the certificate, some people actually decide, you know what, medicine is not for me, as in internal medicine. Some people go down the GP route. So that's also an option. That's actually very good. And some GPs have done MRCP, lots of GPs have done MRCP and core medical training and then become GPs. A lot of them become GPs with specialist interests. So they might do something from their core medical training and use that to their advantage. Other people can go down lots of other things with MRCP. Some people go down the radiology route. Unfortunately, radiology is very competitive because hardly or if ever ends up in round 2. But that's something, if your circumstances allow because of your visa or whatever, then you could go down the clinical radiology route. You can go down the hematology route after core medical training. You can go into infectious diseases, microbiology. All these things require the person to have done MRCP and core medical training. You can actually go on the core medical training website and find exactly all the different branches of medicine that you can go into. Right, so now you've done your core medical training and you want to go into the subspecialist training. Let's take, for example, respiratory medicine. Then you start, this bit of training is for 5 years. So 2 years core medical training and 5 years of subspecialty training. And after that, you become a consultant. Some people may want to do more subspecialist fellowships, so they might do a 6th year of their subspecialist training. So 2 years core medical training, 5 years of registrar training or subspecialist training, and that makes you a consultant. The other thing is, I really want to focus on 2 particular subspecialties after core medical training, which are acute internal medicine and geriatric medicine. The reason I'm mentioning these is because there are jobs available in these subspecialties, and they aren't very big outside the UK because it's relatively newer subspecialties, but actually very popular and getting very big. The UK population and generally the population in the world is getting older, so there's a massive need for geriatric medicine. Now, what is geriatric medicine? I can't do justice to it. I'd highly recommend you look at their website. But generally speaking, these physicians look after the elderly population, but actually most of them have a subspecialist interest. So you can be a geriatrician who specializes in orthopedic geriatrics, so they call orthogeriatrics. You can specialize in stroke, Parkinson's, movement disorders, lots of things that diabetes. So these particular geriatricians I've actually met so many geriatricians who really love their job. The job is very variable and the variety, and as well as the patient cohort is excellent. And so it's a very good specialty to look into. This is just something for you to be aware of. Look into geriatric medicine. There are jobs available, and it's a very rewarding subspecialty from all the people I've spoken to. And I've not come across not many sad geriatricians. They really seem to enjoy their job. The other thing is acute internal medicine. This is an upcoming subspecialty in medicine, and this is the halfway house between accident emergency and somebody who's being admitted into the ward. So most UK hospitals have something called the medical admissions unit or acute medical unit, various names, but essentially the patient might either come from A&E or referred in from a general practitioner, and they're ill enough to stay for a few days, but not well enough to be discharged straight away the moment they come in. So they're sort of halfway, so something in the middle. So this is such a big variety. You can have patients coming with cardiac failure, respiratory stuff, GI bleeding. So you have a huge breadth of things that can come through. And so acute internal medicine consultants are sort of really solid generalists. And in fact, there's a massive need for acute internal medicine consultants. And that's why the government is actually pushing for these sort of jobs, and the hospitals are pushing for these more and more physicians who are generally trained and can deal with lots of things. The good thing about acute internal medicine, again, is you can subspecialize in the thing that you like. So you have acute internal medicine consultants who are subspecialist interest in gastro, so they'll do scoping. You have somebody who specializes in renal. You have people who specialize in stroke. So you've got people you can take. The good thing about acute internal medicine, if you look on their website, www.take AIM, takeaim.org.uk. It tells you all the different things you can do with acute internal medicine. Again, the training program after core medical training is 5 years. Same with geriatric medicine, 5 years. These two subspecialties, not many people from outside know about these, and that's why I want to tell you it, because there are jobs available in these. Okay, so that's sort of the rough structure of medical training in the UK. And then obviously, once you've done that, you become a consultant. The salary of a consultant approximately starts off from £75,000 a year. If you're in England, roughly, you can look at the entire exact pay scale, and then it goes up every year of service. And also on top of that, you can get various bonuses for your service. You can look up on the NHS pay circular for the exact salaries of consultants. So I hope you found this useful. If you have any questions, as always, please send them to me. I'm always sort of willing to help. Share this video, like it, and the idea is if somebody finds it useful and it helps their career develop in the future, that's the exact purpose of this. So any questions, fire away.